This podcast is for informational and educational purposes only and is not to be considered medical advice for any particular patient. Clinicians must rely on their own informed clinical judgments when making recommendations for their patients. Patients in need of medical advice should consult their personal healthcare provider. From UPMC Children's Hospital of Pittsburgh, welcome to That's Pediatrics. I'm Carolyn Coyne. I'm a scientist in the Division of Pediatric Infectious Diseases.
And I'm John Williams, professor in the Division of Pediatric Infectious Diseases and director of the Institute for Infection, Inflammation, and Immunity in Children, the I4Kids. And I am delighted to welcome our guest today, Dr. Megan Freeman. Dr. Freeman earned her MD and PhD at Vanderbilt University, where she earned her PhD working on coronaviruses, including SARS. So she has long experience studying coronaviruses and especially serious coronaviruses. She came to Pittsburgh several years ago to the UPMC Children's Hospital of Pittsburgh as a pediatric resident and is now a pediatric infectious disease fellow, continuing her study of viral immunity and viral pathogenesis. And her fellowship is supported by a highly prestigious Pediatric Infectious Disease Society St. Jude Fellowship, of which one a year is given in the country. And so she really has the clinical and the research background to be our local resident expert on coronaviruses. So Dr. Freeman, Megan, welcome to the podcast.
Thanks so much for having me back. It's a unique situation for me today. I'm being interviewed by two of my mentors.
Remotely. This is actually my first remote podcast, so we're coming to you live from quarantine. Well, thanks so much for joining us today, Megan. So, one of the things that I think has really inspired the topic of this podcast is I think all of our, shared concerns for our kids, right? And so, I think a lot more recently in the news, we've all been a little frightened by these headlines that have been talking about these serious complications of coronavirus infections in kids. Whereas I think pretty, earlier in the pandemic, I think that seemed to suggest that kids were spared. And so maybe you could kind of take us through a timeline. What was the early evidence that, kind of led us to believe kids were okay? And then maybe some of the more recent evidence suggesting that maybe they're not okay.
Absolutely. I think that's a great question. So early on in the outbreak, when we were first learning about SARS coronavirus 2, both in adults and in children, early data from China and then subsequently around the world, even all the way up through last month, told us that kids were as likely to be infected as adults were, but in general, they were less ill. So when surveillance was done based on symptoms, we detected them less frequently. But when they started looking in family clusters, they were more likely to find that a kid had been infected, but maybe they just weren't showing any symptoms. And I think this has continued to be true even in the United States. But we're now learning about these new syndromes that could be related to coronaviruses. And I think that's got everyone a little bit worried. So I think a couple of things to talk about in relation to that. So these are two separate entities. So we think first of SARS coronavirus 2 infection, the cause of COVID-19 as an acute illness. So the patient has acquired the virus is replicating in their nasopharynx, and they're having those symptoms of maybe fever, cough, fatigue, myalgia, and then that often in adults will proceed to respiratory failure, need for intubation, et cetera. And then people recover. Right? And in kids, we're maybe not even seeing any of those symptoms that we're seeing in adults. But this new syndrome that's being described, MIS-C is its new official name, or multi-system inflammation syndrome in children, is a disease that is described to be like Kawasaki disease, something we've known about for decades, but a little bit different, that has been happening in the context of this SARS coronavirus 2 outbreak. And it's thought to be an immune system driven condition that occurs after an acute illness with SARS coronavirus 2. And because often kids are asymptomatic, we may or may not detect that they have been ill with the first syndrome to begin with. So then later they're popping up with fever and lots of inflammation that is making kids really sick. I think the other important thing to remember is that this syndrome is seen in a minority of children who have come into contact with this virus. And again, for the most part, kids handle it very well.
I guess so. Maybe the first question that I would have coming at you, sort of from the side of a parent of an 11-year-old, is so let me just to make sure I understand that maybe the delay then in observing this new syndrome earlier in the pandemic was just that was kind of the first wave of kids getting infected with a minor asymptomatic infection disease. Now we're seeing the sort of emergence of this inflammatory syndrome. Is that sort of the correct way to think about this?
I think you're exactly right. So a lot of the kids that have been reported that have these syndromes had an exposure or a mild illness somewhere in the neighborhood of 2 to 6 weeks ahead of when they presented to the hospital with the more severe symptoms.
And so you mentioned that this was a real minor kind of portion of the kids that are infected. What kind of percentage are we talking?
It's a little bit difficult because my hypothesis, and I know many in my group as well, is that the number of kids in America and around the world that have been infected is probably underreported based on symptom-based testing. But what's been reported in the literature is children in the tens to hundreds have had this inflammatory syndrome, and children in the thousands have been reported with the traditional acute infection.
And so things aren't changing, it sounds like. In terms of respiratory illness, we're not seeing a lot of kids with severe respiratory illness. That hasn't changed since the beginning of the pandemic, correct?
Correct. And there's actually a really great study of the PICUs in the United States and Canada that just came out that had only a handful of kids, 50 overall, that had landed in the PICU. And the overwhelming majority of those kids had underlying conditions. So were either medically complex or had cancer in their history. So in general, we're not seeing severe respiratory illness in children.
Well, and just to put that's good to know, and to put a little context on that, as you both know, in this year, in this country, every winter, millions of children are infected with influenza, tens of thousands are hospitalized, and hundreds of children die from influenza each year. So this pandemic is not flu. From a pediatric standpoint, that's a good thing. It's for the respiratory illness. So why, Megan, do you think we didn't recognize these inflammatory, these rare inflammatory syndromes earlier in the pandemic?
I think there's probably a couple of factors at play there. One, it just took them longer to present because they're presenting probably after an acute infection. So some of that time had to elapse. I think they can also look similar to entities that we already know that exist. So Kawasaki disease is what's come up a lot in the press. And Kawasaki disease is something that we see usually in young children under the age of 3, 5,000 cases a year in the United States. And this is an inflammatory syndrome that is characterized by kind of a discrete list of symptoms, including many days of fever, big lymph nodes, rash, swollen hands and feet, cracked lips. But we see it with frequency in the children's hospitals. And, the syndrome that is presenting now has a lot of those shared features, but it also has some differences as well. But I think it would be easy to imagine yourself in the middle of a world pandemic like we are now, where the healthcare system is already dealing with a lot of other things, to see a kid with what you think is Kawasaki disease and not necessarily put together that it might be a different syndrome.
And so, I guess on the heels of that, what should parents or healthcare providers be looking for? Obviously it's a very rare disease, and perhaps in Pittsburgh, it's unlikely that hopefully that any of us will see it, but what should people be looking for?
So the symptoms are several days of fever, often accompanied with red swollen eyes, conjunctivitis, maybe a rash. The rash can look like anything. And the things that always get us worried and want you to take your kid to be evaluated would include not eating or drinking, not breathing well, not waking up appropriately. So just any of those things that you as a parent are already on the lookout for with your kids would be reasons to take them for medical care.
From the literature, the reports I've seen on this, Megan, it sounds like these kids are pretty sick. They're not running around with a little bit of a cold and slightly pink eyes. They sound like they're pretty ill.
It's interesting. This is one of the differences that I think is probably most notable between the traditional Kawasaki disease and what we're seeing with MIS-C, is that a majority of the kids that are presenting with this illness are needing support for their heart. They're PICU level sick. They're presenting in shock with poor blood pressures. And while that can happen in a minority of Kawasaki disease patients, it's not nearly as much as it seems to be in these kids with this hyperinflammatory syndrome that's happening now.
So, within our county, we've obviously just moved to the next phase, right, of our lockdown into yellow. And so, perhaps a naive question, but I think a question that's probably on the minds of a lot of parents, at least, is how do we protect our kids? What do we need to do? Kids have obviously, again, I'm a parent of an 11-year-old who's been cooped up for the last couple of months, right? What can we do? What should we allow our kids to do? How can we protect them from it, in my mind, getting infected in the first place, obviously with the hope of them, not, of course, then developing this more severe sort of inflammatory response.
So I think there's a lot of reasons to try to continue to keep from getting infected. So one is, just like you're saying, avoid the illness associated with the virus, avoid this rare inflammatory complication, but also to avoid spreading virus to your grandparents or your teacher that has a kidney transplant or anybody else in our community that might be at risk. So the advice is the same. Certainly if you're home, stay sick. Please cancel that. If you're sick, stay home. And when you're out and about, try to remember not to touch your face, be careful with hand washing, wear a mask to help protect others from your coughs and sneezes, and do a lot of those things that have become routine over time. But, as we're starting to relax a little bit and keep an eye on the numbers very carefully at the community level, it's, maybe okay to go to the park or interact with a couple more friends than you were used to seeing. So I think this is a new area for all of us as we're relaxing a little bit, and we're going to have to see how it goes. But I think it's important to start to take those next steps.
I think you just made a really good point though, Megan, about, the CDC and other public health authority guidelines are that we're in a middle yellow. Our state is calling it yellow. We have red, yellow, green, but many other states have slightly different variations. But while society is opening up some, people still need to take those steps of hand hygiene, masks, 6-foot distance. Because I think a concern a lot of us in the field of infectious diseases, virology, public health have is that people flip the switch from red, quarantine, stay home, to green, all systems go. And then we'll just toggle back and forth between red and green. So I thank you for emphasizing we still need to keep those measures in place.
And it's going to be different from community to community. In areas where we're still seeing a lot of spread, a lot of high case numbers, that area needs to be a little more restricted than someplace that hasn't had a new case in 2 weeks. And I think that we're going to have to work really carefully in our local communities to try to make sure that everyone is making decisions based on their local data.
So this is probably a bit of a tough, maybe unfair question, in that I know the field is moving, I think, at a very rapid pace. Where are we with therapeutics? There's been lots of talks of development of vaccines. Where are we? What does the future look like for the development of therapeutics that, again, in theory, we could then implement vaccination, let's say, in kids?
The thing that's kind of amazing that I think the public is starting to realize is science takes time. And the amount of progress that we've made so far on SARS coronavirus 2, which is the virus we've known about since December, and now it's May, has really moved at lightning speed. And that brings its own challenges, sifting through the well-controlled, well-executed science. But it's really been impressive to see what the scientific community has been able to come up with. I think that your question kind of veers into two separate topics. So I'll tackle therapeutics first. So there have been a lot of groups that have been working on both therapeutics that we thought might work or have known to work, and also looking for new therapeutics. And a lot of those have moved to trials around the world, which is going to be incredibly useful as far as seeing if they're actually able to make a difference on patient outcomes. I think one of the challenges that we have with antivirals in general especially for RNA viruses, is you are sick with a virus and the virus itself is replicating and causing disease really only in the very beginning of the virus. And then the rest of the syndrome that you're feeling is your own immune system trying to fight it off. So if we don't get antivirals in very early, it's really difficult for them to make much of an impact on an illness. This is particularly a problem with SARS coronavirus 2 because there are many people that seem to be housing the virus and it's replicating for a few days before they pop up with symptoms, or maybe they never pop up with symptoms. And it's hard to get an antiviral to a person that you don't know is having symptoms in the kind of proper amount of time. So that's certainly something that people are still investigating, but I think that vaccines are probably going to be the more helpful solution to this problem. And vaccines are being developed all around the world in a variety of platforms. There was a bunch of news yesterday that the Moderna vaccine had a successful, very small trial of 8 patients, that they had detected some antibodies that seemed to be neutralizing when then challenged in the lab, and also seemed to make antibodies in people that were similar to levels seen in people that had native infections. So I think we're going to learn more and more about those all the time. The next challenge is scale. So 8 people is not all of the people of the world. So we are going to have to, still go through trials of safety and efficacy. They've got to figure out dosing. And then even if they had a perfect vaccine that was ready to roll tomorrow, you have to scale up your production and get it administered to as many people as possible. So it's still going to take some time.
Well, and what are the challenges in children? So, we're talking a lot about sort of, the testing of new either antivirals or, vaccines or, other therapeutics. But obviously, I imagine the challenges are quite different in the pediatric population, right?
They're often not included in these trials. So even, remdesivir, which is one of the drugs that has gotten the most attention for being, especially in vitro, effective against SARS coronavirus 2, the children are not enrolled in remdesivir trials. You are able to obtain remdesivir for children in kind of a compassionate use scenario, but they're often excluded from these sorts of trials, especially in the beginning. And then when we're thinking about them being affected maybe more by these post-infectious inflammatory syndromes, that's too late for a pure antiviral really to be able to be much help.
Mm-hmm.
Yeah, that's a question that I had, Megan, and I wonder what your thoughts are on it. Is that, if this inflammatory syndrome is thought to result from some sort of aberrant immune response to the infection that happens in a very tiny minority of children, wouldn't that be a potential concern with a vaccine, that it might also trigger like an aberrant immune response after a vaccine?
That's a great question. It's one I don't know the answer to. Certainly it's possible. And we have had challenges with vaccine development in the past, including dengue virus vaccine, where in early trials, and this is why we do trials, they saw that some children were having kind of an enhanced illness presentation after having been vaccinated, which of course is not what we want. So we have to make sure that while there is a lot of time pressure to get this done, that we're doing it correctly and safely. And that's why it takes us some time.
So I'm going to ask another tough question. What that you may not have an answer for, and that's okay, but I'd be curious about your thoughts. What does the future look like? We're sort of right at a point, everybody is sort of, John mentioned, we're going from, red into what everyone is assuming is green, which is of course incorrect. But what does the future look like? What do you predict kind of our outlook is for the next several months? I think particularly with kids. I know a lot of parents are concerned about, summer camps. Is my child going to go back to school in the fall? And of course, I recognize these are not decisions that we as clinicians or scientists make, but what do you think the future looks like?
We still have a lot to learn. It's really hard. I've learned during this time to make predictions that are too far away. So it's much easier for me to make a prediction about next week or next month than it is for me to make a prediction about returning to school in the fall, for an example. I think it's a little bit age dependent too. So I, would trust a 16-year-old to be able to follow hand hygiene and masking suggestions and to stay 6 feet away from one another. I would not trust a 2 or 3-year-old to be able to do that. So when we think about kind of learning more about children's role in the spread of virus in community, especially young children, thinking about the daycare population, I think that is going to be a lot at play in those decisions. And it might not be a one-size-fits-all sort of prescription for kids of all ages. Might be more, as pediatricians, we're very used to developmentally based advice, and it might be something along those lines. It's just hard to know how everything's going to look. And then even thinking about how are sporting events going to look? We love our big sports in Pittsburgh, but maybe you're not going to be as willing to sit so close to somebody that you don't know on bleachers for a while. Maybe flights will look different for a while. It's just really hard to know, having not lived through something like this before, how it's going to look on the other side.
Yeah. And I think until, the advent of a vaccine, we may be living a very different, reality. I keep telling my son that, we're living through history right now. It's a time that none of us have seen. And so all of us are ill prepared, but we just kind of have to do our best and make the smartest decisions we can based on science.
Yeah. And try to figure it out based on the data, which I think is a great opportunity for us to be able to share with people that have never been interested in viruses before, how we study them and how we combat them and how we can use kind of the testing data to help us make smart decisions about our community.
Right. Well, thank you so much for joining us today, Megan. This was great.
Oh, thank you for having me.
Megan, thanks for joining us on the podcast, and thanks for all of your work to help guide our policies in the hospital and help educate our community. You can find other episodes of That's Pediatrics on iTunes, Google Play Music, and YouTube. Be sure to subscribe to keep up with new content. Please leave us a review and tell us what other topics you'd like our experts to cover. Thanks for listening.